Hello, everybody. Thanks for joining us for our first Lunch and Learn series for 2026. I'm Susan. I'm with Indiana SHIP, the State Health Insurance Assistance Program, and I'm joined by my coworker, Megan Rogers, who's going to be sharing with us some terrific information today. We are live. If it is noon Eastern Time or 11 Central Time here in Indiana, on January 8th. And so that allows us to answer your questions in real time. And you can do that by communicating directly with Megan or me or chatting in your comments on the Facebook page. And I'll be monitoring that as Megan is sharing her information. Today, our first Lunch and Learn, and feel free to chew away. Um, we're going to talk about, do you really need Medicare? Megan, when you're at community events, what is the number one, maybe two question that you get from people?
I am still working. Do I need to take my Medicare when I turn 65 in a couple months? Or my spouse is still working and I have their employer insurance. Do I need to take Medicare?
I get that question all the time, or they say, I know I have to sign up for Medicare because I'm turning 65. How
Mm-hmm.
do I do that? And then
Mm-hmm.
we usually take a couple steps back and clarify. And that's what we're going to learn about today. So, Megan, thanks for preparing this presentation. Folks, chat in your questions if you'd like. And Megan is going to talk to us about, do you really need Medicare?
Thank you, Susan, and good afternoon, Facebook. So, yes, our topic today is, do you really need Medicare? So, the answer is, it depends. So, that's the short answer. Let's get into the long answer. So, first, we're going to pull it back and answer a basic question. When do you become eligible for Medicare? Where there's three times or three situations that you would become eligible for Medicare. The most common is you turn 65. Then if you have SSD, which is Social Security disability, for 24 months, then you get Medicare at the 25th month. And that you don't have to be 65. You might be 40. You might be 47. You might be 64. So as long as you've had Social Security disability for 24 months, on that 25th month, you get Medicare. And then if you are diagnosed with end-stage renal disease of any age, you also become eligible for Medicare. So if you meet one of these markers, you turn 65, Social Security disability for 24 months, or end-stage renal disease, you can delay Medicare if you have employer insurance. So if you're still working and you plan to keep working past 65 and you have employer insurance, you can delay your Medicare. If your spouse is still working and you have employer insurance through your spouse's employer, then you can delay your Medicare. Or if you have retiree insurance. Now, there's different type of retiree insurance. Every retiree plan looks different with your employer. So some of those do require you to have Medicare. However, I have encountered a couple different retiree plans that don't require you to have Medicare. So if you have retiree insurance that doesn't require you to have Medicare, then you can delay that. Now, some things you need to know if you are delaying your Medicare. You do not need to alert Social Security Administration, SSA, ahead of time. That is one of my other top questions I get. Well, do I need to contact them ahead of time? Do I need to apply to get into the system at least? Do I need to send them a letter? No. You do it on the back end. You delay, and then when you are ready to get Medicare, then you're going to apply. And there's a special form that you'll submit at that time to let them know this is why you delayed it. and it's going to remove a penalty. And I'll talk more about that in a minute. When you are eligible for Medicare and you have employer insurance, either through your employer or your spouse's employer, you are basically in a continuous special enrollment period. That means that means while you have employer insurance and until you retire or your spouse retires and you get on to Medicare, you basically can enroll in Medicare at any point. You don't have to be retired. Your spouse doesn't have to be retired. You can change your mind at any point and get on Medicare. Ideally, you do want to start the process 3 months before you do need Medicare. That way, it's going to hopefully, or should be, started by the time that you really need that Medicare insurance to start. I had a client call me several years ago, and he left me a message, said that he had employer insurance through his spouse's employer, and she was getting ready to retire, and he needed to know how to get on his Medicare. She wasn't eligible for Medicare yet. So I call him back and I said, well, when is she going to retire? And he hesitated a minute and he goes, well, she plans to leave in 2 weeks, but she's not planning to tell anyone. Oh, okay. Well, we might be able to make this work, but it's gonna be a bit. So I told him, I said, well, you need to hang up with me now, and you need to call Social Security and get that process going. And when you have all that started, you call me back and we'll talk next steps. Now, surprisingly, it all worked out. He got his Medicare very quickly before the employer insurance ended. And I think that employer insurance ended at the end of the month that she stopped working. So at that point in time, a couple years ago, it worked out. I would advise against that kind of situation, but if that's what has to happen, we'll guide you the best we can. Susan, you have any situations like that?
Yeah, a lot of people I talk to, especially when I'm at events, they're just not sure when they want to retire. And so we give them all the information that they
Mhm.
need just so they can have it in their mind, including one important point about Medicare is that Medicare only starts on the first of every month.
Thank you, Susan. Yes.
And so when people do decide to retire and
Mhm.
go off their employer group plan, they need to make sure that there's not a lapse in coverage unless they're okay with that risk.
Mhm.
And that means making their employer group plan last through the end of the month to have Medicare start on the first day of the following month. So I do try to share that with folks
Mhm.
because a lot of people think it can start at any time, but it doesn't, only the first of the month.
That is a very good point. And
Mhm.
I actually had a client where their employer insurance ended the last day that they worked, and this person stopped working in the middle of the month. So they had to decide, did they want 2 weeks of no health insurance for the Medicare to start the first of the following month? Or did they want to double up on insurance for a couple weeks for the Medicare to start the first of the month that they were um, no longer working? And then they would have employer insurance and Medicare for a couple weeks. And I think they actually did go with having a lapse in coverage for a couple weeks. But like you said, that's a decision they have to make. That's a personal decision on what they are comfortable with. So,
Right. And if they're eligible for COBRA, if something would have happened in those 2 weeks of
mhm,
technically lack of coverage, they
mhm,
could have gone back and claimed their COBRA, made the big old payment, and had some help with their medical bills. But
Exactly.
again, it's rolling the dice, and that's not for a ship counselor to decide. We
Ex-
just,
Yep,
give people the information and help you process it out.
exactly, exactly. All right. So if you have Medicaid, VA benefits, COBRA, Marketplace, or no insurance, you do not want to delay your Medicare because these are not what is known as creditable health insurance. You have to have creditable health insurance um, to be able to delay your Medicare without a penalty. And I went back a couple slides. So, employer insurance, whether it's your employer or a spouse's employer that you have insurance through, they are, and retiree, are generally creditable. And creditable means good as or better than Medicare. So, if you have employer insurance or retiree, you can delay your Medicare penalty free. But if you have insurance that is not creditable, Medicaid, VA, COBRA, Marketplace, no insurance, then, and you delayed getting your Medicare, then you would get a penalty. And that would be a lifetime higher premium that you would have to pay for your Part B and your Part D, your medication coverage. So, the other thing that you need to know besides that higher premium, that penalty, is let's say you turn 65, you're now you didn't get Medicare, you didn't have health insurance, you didn't feel like it was worth it, you don't go to the doctor, so you delayed your Medicare 5 years. So now you're 70. And you start having some health issues. You still don't have insurance, but you decide that you need insurance. So you call Social Security because that's who you apply for Medicare through. And it's August. They're going to tell you that since you are no longer in your initial enrollment period, and that is 7 months, 3 months before your 65th birthday, your 65th birth month, and 3 months after that birth month. If you're out of that 7 month range, you cannot apply for Medicare in any other month than January, February, or March. That's your general enrollment period. So if you did not take Medicare when you're 65, you did not or do not have employer insurance through your employer or spouse's employer, you will have to wait until January, February, or March of any year to apply for your Part A and or your Part B. So that's definitely something to be mindful of because if you were that client that called in August, you would have to wait 6-ish months to get your Medicare. And if you apply during the general enrollment period, your Medicare will start the first of the following month that you applied. So if you apply in January, it will start February 1st. So if you have questions or you want to sit down with a ship counselor about your options, if you are considering delaying your Medicare, you can call us at 1-800-452-4800. You can visit us on our website, medicare.in.gov. And if you're watching us on Facebook, you've probably already follow us on social media. Susan, are there any questions?
There's no questions right now.
Okay. If you do have questions, if you watch us, the recording, chat them in the chat box. We monitor that. We get an alert. Or you can Facebook message us and we will respond to your questions as soon as possible. Remember, today was just a quick overview of do you need to take Medicare? Everyone's situation is different. So feel free to reach out to us If you are considering delaying it, to make sure that your situation appears to meet the guidelines to delay your Medicare penalty-free. Susan, is there anything that I missed?
Not that I know of.
Okay, we're on the same page. All right, so Susan, do you want to tell Facebook what we have coming up next in this new series?
Yes. And we're planning these lunch and learns, one each month. So the next one coming up is February 12th, noon Eastern Time, 11 Central Time. And we're going to talk about options for coverage. What do you need or what might you like to have in addition to Medicare? So, we're going to be talking about all of the different types of options that might supplement your Medicare benefits.
Wonderful. Thank you, Susan. And we will be back for our normal Facebook Live Mondays and What to Know Wednesdays as well. But we're excited to start this new series with the Lunch and Learn to give you some more information on Medicare. All right. Well, Susan, if you don't have anything to add, I think we will wave everyone goodbye. Bye, everyone. Thank you for watching.